everybody. It's Peggy Hasenauer. I am checking in with my colleague Maggie today, who is an amazing clinical pharmacist who partners with us at the Kovler Diabetes Center. Hi, Maggie. How are you?
Thanks so much for having me.
Oh, geez, no problem. We are so grateful to have you. And we are sort of creating different opportunities for people on our team to tell us about who they are and what they do. And I think for many of us who are staying at home right now, we need some perspective and advice, particularly from a pharmacist, about how to do a better job managing diabetes and other chronic conditions. So thanks for coming. Maggie, tell us a little bit about you and how long you've been with Kovler, and what your role is in the context of the University of Chicago.
Awesome. Yeah. So I started with the clinic in November of 2018, actually. And it was kind of a slow transition. I wasn't fully dedicated to the clinic because I had other responsibilities with another clinic. But slowly and surely my role became really necessary, and that I really did serve a huge need for the physicians and both the patients, the physicians and the patients. That transitioned into a full-time position. So I was fully dedicated to the endocrinology clinic.
And you still are, and you're not getting out of it because we need you.
Yeah. So I think in a nutshell, what my job has turned into is like a medication detective almost. So I do a lot of things in the clinic, but in terms of like patient facing things, I can help out the MAs with doing medication histories and reconciliations, especially with the complex, there's a patient with a lot of medications and a lot of chronic diseases. So I can tee them up for the doctor so that it's easier for the doctor to focus on the things they need to during their visit and not focusing on the crazy medication list. I do a lot of patient education, and that caveat is that a huge role that I have in the clinic is making sure that if a new medication is going to be prescribed, that it's going to be covered by their insurance, so that when they walk out of the clinic, they know exactly how much to expect to pay at the pharmacy. They know that it's going to be covered and they're not going to experience any hurdles. And if we do identify that it is going to take a couple extra steps, I can tell them that, and that they know that someone is working on it and someone's going to follow up on getting a prior authorization approved or other necessary steps through the insurance.
I think I was going to say, I think that what's so unique about Kovler is we have all these amazing experts who are with us, and to have someone with your expertise as a PharmD in our clinic actively helping patients sort out the medication maze, because it's a maze, it's a puzzle, particularly in a world where there are tons of diabetes medications on the market. Mm-hmm. And we often manage patients on a multitude of those medications. The medications can change, the formulary can change through insurance. So I can't believe, we pinch ourselves every day that we have someone like you, Maggie, on our team to help us and to help our patients. It's probably not something that is available for most people with diabetes unless they come to Kovler.
Mm-hmm. I think my position is turning out to be more and more common in terms of, like, I tell patients I'm a pharmacist and they're confused because I don't work in a pharmacy, right? So I work in the clinic with the doctors, and I kind of serve as a liaison between either the DCAM pharmacy if they go to Kovler, or outside pharmacies as well. So I can speak the pharmacy language and I also speak the doctor's language. So I'm kind of like a liaison between the doctors and the patients and the pharmacies, and deciphering all the different language and confusion and things with the insurance. Sure. And it can be a maze, like you said. So just trying to help patients get access to their medications in the shortest route possible.
I appreciate that. So in this day and age now where all of us are at home, Dr. Phillipson and many of our physicians are seeing patients via sort of virtual visits or telemedicine visits. So how are you currently partnering with our patients at the University of Chicago at the Kovler Diabetes Center, and partnering with the physicians now that you're not seeing them in the clinic in person?
Mm-hmm. So I have been doing a lot of, after the physician has seen them via video or telephone, they will ask me because they have an idea of medications they want to change or initiate, or, patient needs extra education on some instructions they were provided. So then I'm tagged in after the visit right now, and then I contact the patient and go over administration of the drug via phone, or like instructions. And I tell them, the price of the medication or how much it will cost, and ask them, actually, I offer, one of the huge benefits of Kovler is that the DCAM pharmacy can mail out prescriptions. So if the patient really does not want to leave their house at this time, I can set them up through the DCAM mail order service, and then, close the loop and make sure that they get their medication as soon as possible.
That
Um,
that's incredible. And that's one of those, again, one of those value added services that we've tried really hard to create and provide at Kovler. But the piece that I often struggle with, and I'm a nurse by trade, I'm also a mom, is when you pull up at the pharmacy, whether it's the drive-through or your local, in-town pharmacy, and they say that'll be $375. You're shocked by it. And I think what's so pivotal about the work that you do is you can help people understand what their insurance covers. And if I'm not mistaken, you can also help guide the physician if there's perhaps a medication that their insurance covers that maybe the doc doesn't even know about.
right. So that's the whole detective
Yeah.
hat that I wear. We do, investigation using our own pharmacy system. It's really a benefit that I do have access to that, because I can act like your Walgreens and run the claim through your insurance and see exactly what it's telling me back. I can also investigate, like you said, maybe something else is preferred, which is less expensive. Or we can talk about savings cards if you have an insurance that qualifies for that. If you don't qualify for that, we can talk about maybe, what's the day supply the pharmacy is trying to give you? Is it a 90-day supply? How much is a 30-day supply? And doing manipulations like that to make it more affordable in the short term. And then also seeing if, all those options are exhausted. DCAM does offer some diabetes medications at a low cost for our patients. So that is also an option. And the last resort is applying for any of the manufacturer patient assistance programs.
So that's amazing. So I think that that's a value that we provide. So certainly it's fantastic if everybody becomes a patient at Kovler. And in fact, we're still taking new patients. So if people are interested in switching endocrinologists, or they want access to all of our amazing team members like you, Maggie, they can still reach out to us. But what if people watching this video are not patients of the University of Chicago Medicine? So they don't access any of our physicians through the network, and maybe they live in Milwaukee, Wisconsin, or they live in Rockford, Illinois, and they want to understand or maybe get some tips during this COVID-19 crisis on how to better manage medications. What would you say to them?
I would say the insurance can be an overwhelming entity to kind of take on yourself as a patient. But I think that if you can call the customer service line, especially if it's a cost issue, if you can call them and ask them for more information about why the cost is so high. I'm sorry, my dog is making that noise. If you can hear that.
It's all right. We're all at home. My faux tree almost knocked over. Whoa. Okay. Anyway, so let me ask you a question about that. So
Yeah.
when you say call the number, are they calling the number on the back of their insurance card? Are they calling their local pharmacy? What number are they calling?
The customer service line on the back of their insurance card. Yes.
Okay, got it. Okay. So and so oftentimes though, so I'm curious what your experience is. So for instance, I've called that 1-800 number before, right? And you get someone who answers the phone who doesn't know you, who doesn't know that you have maybe type 1 diabetes, who doesn't know or realize, okay, I'm at home right now, I can't get my medicine. What are some buzzwords or some things that you can say to that person who answers the phone to let them know exactly what you need?
Yeah.
Because you know how to get through the system, but maybe the average person doesn't. So tell someone watching this video right now, when you call that number, what can you say? What do you say to get through?
Yeah. So I start off by introducing myself and saying that you have a question about medication cost and formulary preferences.
Okay, formulary preferences.
Mm-hmm.
My name is Joe Smith. I'm 45. I have diabetes, and I have a question about medication cost and formulary preferences.
And they will ask you a bunch of questions to basically make sure that they're talking to the person on the insurance card. So make sure you actually have the card handy with the ID number. and they're probably asking your date of birth or your address or your phone number. They can ask you any of those questions. But once you get past that step, it's, identifying the problem. If it's a cost problem, saying this medication is this much money at my pharmacy and I want more information about why. And it's this class of medication. So it's insulin. It's a long-acting insulin, short-acting insulin. And you can ask your pharmacist like what class of medication if you're not sure what it is. But if you have the medication or you have the name of it, you can always spell it for them as well too,
Cool.
because it is kind of crazy that a lot of these representatives are not trained in healthcare a lot of
Correct.
times, and they don't know how to spell the medications. They don't sometimes recognize the medications if you just say them. So a lot of times you have to spell it out for them. But yeah, formulary preferences and tiers of medication.
Okay.
The cheapest medication is going to be so it's usually on a 5-tier system. Tier 1, tier 2 is usually the cheapest, but a lot of times these diabetes medications are all brand name. So the lowest tier a lot of these medications will be on is 3 a lot of times.
Okay.
But if you're prescribed a tier 4 medication, but then there's a tier 3 that is more preferred, that would be the one that you would want to be switched to.
So when you have that conversation, you learn that, and then for someone who's not a Kovler patient or a Chicago patient, you as the patient would go back to your own primary care physician or endocrinologist and say, hey, I know you prescribed this insulin for me, but this one actually would be preferred or paid for through my insurance. Would it be okay if you switched? So you could have that conversation with your doctor and to feel okay doing that, right, Maggie?
Exactly. Advocating for yourself, and your doctor doesn't want you to pay hundreds of dollars every month for your medication. I can guarantee that. So once they know, I would bet that they would change it if they had the information. Yeah.
Cool. So then tell me, if you are a Kovler patient, so say for instance, Dr. Phillipson has a patient who needs a prescription refill or maybe recently saw Dr. Phillipson via telemedicine. Do they contact Dr. Phillipson or do they contact you if they're a Kovler patient to ask specific questions about their medications? And how do they do that? Like, how do they contact you?
So the way that the messaging system, if you're going through the MyChart system, works is that it gets routed to the nurses, I believe, first. So if you say, I have a question about my medication, usually you'll get called back by a nurse. But if you say, I have a specific question and I want to talk to the pharmacist, they all know who I am and they can send me the message. If you just got off the call with the doctor and you have a question about your medication, I'm sure that they would send me a message as a follow-up. But you can always ask to speak with me. It's kind of hard right now in terms of like a phone number to call because I'm at home, but I do have an extension and clinic that can be used, but it's not active right now.
Okay, so this is great though. So really what we're trying to encourage people to do, as much as I'm not crazy about sort of, electronic medical records as a user, but really what we all have to do as consumers and as patients at home, whether you have diabetes or something else, is we have to get used to whatever charting system or emergent, electronic medical record is available through our physician. So with Chicago, it's MyChart. So if you go on uchicago.medicine.org, you should be able to click on a button that says Access MyChart. And you can create a username and a password, which then allows you to communicate with our nurses and our physicians, and also allows you to take a look at your most recent lab tests. But Maggie, to your point, you can send a message through what's called the in basket to the nurse or to the physician. And in this COVID crisis, I think the good thing is that we're all looking at the in basket all the time, right?
Mm-hmm.
We're all in front of our computer waiting to hear from patients, and we can ask specific questions and try to find you that way. Is that right?
Exactly.
Okay.
If you get, I believe the system is set up for capability of if you need a refill or you want the medication filled at the DCAM pharmacy, you can specifically change it in like the medications tab, and you can say DCAM pharmacy mail order, and then it'll be routed to the DCAM pharmacy, and then they will know to set you up for mail as well.
Okay. And DCAM pharmacy, for those people who aren't U of C people, we call the DCAM, it's really the Duchess Law Center for Advanced Medicine. So it is our outpatient clinic building where the Kovler Diabetes Center resides. And we always call that DCAM. And inside the DCAM is this amazing pharmacy that's actually being led by my good friend, Denise Scarpelli, who came from outside and is phenomenal. She is really moving U of C and moving pharmacy from a clinical standpoint in a new direction that is so powerful and exciting. I want to get back to something, Maggie, you mentioned, which was really making sure people know what medications they're on, because somebody asks you a question, you should probably know. So I remember running into this with my father years ago, who had type 2 diabetes. He had no idea what medication he was on and ended up in the emergency room in another state. And my mother and I, who are both nurses, were like dying. We were like, Dad, how do you not know this, right? So one thing people can do from home, and you'd probably agree with me, is to go in your medicine cabinet, figure out what you're taking, get out a piece of paper, and write it all down, right? Okay. So once you do that, you could go on my chart and you could then look up all the medications that are listed for you in my chart, right? Okay. And if there's a mistake or an issue, say for instance, like your electronic medical record through your doctor or through Kovler has medications listed on there that you're like, I don't even know what these are. Like, I haven't taken these. Am I supposed to be taking these? Who do I call? What do I do? So Maggie, what do I do?
That is a really good question, because it's usually, we're in a weird time right now. It's usually the patients coming in and we are asking, we go through, someone from the clinic goes through your medication list, right? So now we're asking you to reconcile what you have at home and then what is on your list. I would say that you can message your doctor or whoever
I love that.
prescribes that for you. And if you do have a question about if you're supposed to be taking it or not, and you're not taking it, they probably don't know that. So they need to know. And then they can either send you a new prescription if you need a refill, if you're supposed to be taking it. I think that a lot of these are moving pieces, and anyone that touches the medical record can change your list. Unfortunately, cool. That's how it's set up.
Yeah.
So it can be wrong a lot of the times.
Okay,
so
or old. Somebody took antibiotic 4 years ago and it's still listed on there. So let me ask you this. There are people right now that are really struggling, that aren't working, that have lost their insurance, that are really financially struggling to manage diabetes in the context of how do I pay for this? So what would you recommend people do, or what resources as a clinical pharmacist do you have for patients right now who are really struggling to try to afford their medication for diabetes?
So I think the first point is, if you are going to pick up a medication at the pharmacy, or you're having a loved one pick it up for you, you're not the one picking it up. You have limited funds during this time. You want to make sure that you are only getting what you need from the pharmacy, right? So you have to take the inventory of the meds that you have. So which ones you don't need right now, and then which ones you do, because a lot of the times the pharmacy will have something ready for you that you necessarily don't need right now because you have some at home, right? We don't want you to be paying money for that when you don't need it now in this crisis. So I would say getting the inventory straight at your house and knowing what you need to pick up right now. That's the first thing. The second thing I think is open communication with your doctor, because there might be someone like me, if you don't go to Kovler, that can really, a social worker or medication assistance program that can help you navigate different programs and things like that that have just opened because of COVID. And I think we're going to be posting the resources available.
Right.
But I'll just go over a few of them. The Novo Nordisk manufacturer, they manufacture a lot of insulins. They have a new program specifically during COVID that if you've lost your health insurance and or your job, you can possibly qualify for a free 90-day supply of insulin.
Amazing.
And all of the information will be, more details will be posted, but there's no proof of income required, which is amazing. and they, on their website, they say they will check in with you before the 90-day period is over to see, what the status is, and then possibly send you another 90-day
Wow.
supply. There is also a program through Novo Nordisk where you can get, if you're in a pinch, you're applying for a patient assistance program, but you need a refill right now. There is a program that you can go online and click and sign up for it, and you can get an instant download of a card, and you bring it to your pharmacy, and you can get up to 2 packs of pens or 2 vials of insulin for free.
Great.
And that is like an immediate solution, because I believe they will be mailing it to you for the other program, so it might take, there might be a delay. So this is a solution that you can get. You can go online, get the card, and then go to the pharmacy the same day and get the free supply of insulin.
Sam, what if you're not on a Novo Nordisk product? You're on perhaps an insulin made by a different company, or people have contacted me recently as a nurse, and they've said, hey, I heard that Walmart is, you're able to get insulin at Walmart. Tell me the difference. And is that okay? And is it bad or different? Give us some perspective about switching insulins, and if you have to switch insulin, what to know about that.
Yeah, so it's always going to be a conversation with your endocrinologist or primary care physician, because you cannot switch insulin on your own. The insulin that is available at Walmart is a different type of insulin, and it lasts longer in the body. So it requires probably a dose change and a conversion and a lot of education around how to take it as well, because the onset is not as fast, and also it lasts longer in your body.
Okay.
Those, I believe that they have pens available, but I think most of those, the cheaper insulins are via vial and syringe.
Okay. Right.
So that's another thing to keep in mind as well. But you always have to talk to your doctor before changing insulin, because you do still need a prescription as well. So your doctor has to send that in for you.
No, I appreciate that. I think what you have been able to provide us today is probably more than people have heard in the last year at their physician's practice, unless they're seen at Kovler. We are still accepting new patients. We're still interested in seeing people who have diabetes, whether you're newly diagnosed or you were diagnosed years ago. I know that you've brought up so many important points today, and we're so grateful for that. Do you have any other parting words or words of advice as we're sort of wrapping up today? Because this will not be the last of my conversations with you on video. So get ready. We're probably going to do like a weekly check-in with Maggie, the clinical pharmacist at Kovler. So what other parting words or pieces of advice do you have?
I would say if you are going to an outside pharmacy, or any pharmacy for that matter, and the pharmacist is telling you that there's a problem with the prescription, we're trying to get in contact with your doctor, we have to wait till your doctor calls us back or gives us an answer. I would really encourage patients to reach out to the doctor's office themselves as well, because there are so many times that the pharmacy is telling the patient that they're trying to get in contact with the doctor's office, and the doctor's office never receives any of that communication. And then that leads to delays in therapy and missing meds and just a lot of things.
That always worries me. That always worries me when you told people, my light just went back on, when you told people that you tell people in the doctor's office, have Dr. So-and-so call me, or I need a prescription refill. Many physicians' offices, as you know, are working with these sort of antiquated fax systems. So to your point, it's best to not always rely on the pharmacy, but to call the doctor's office yourself. Great. Okay. Great.
Yep.
Great. Maggie, I can't thank you enough for your time today. You've just been incredible, and we're looking forward to more conversations with you. You are a gem and a star in our clinic. Dr. Phillipson and all the docs love working with you, as we do too. So everyone, Maggie, clinical pharmacist extraordinaire, this is her first visit with us. There'll be many more, and have a great day. Thank you.
Thank you so much.
Okay. Bye-bye.
Talk to you soon. Bye.
Bye.